In BDA therapy, we have many patients that have scoliosis, and this is one of the reasons why parents come to us. That's because we have a really good results, even with the kids or individuals which have a very severe scoliosis, and not only when they are young, but also when they are older. Look at this boy, for example. We can see when he came to us, the depression that he had was huge. Also, his hump obviously is protruding really a lot. With supported sitting now, he is less deformed. The press side is smaller, and the hump is also much smaller now. Previously, when he was laying on the stomach, he had much bigger curve. Now, he's more straighter. From this view, we can see his hump more clearly. Previously, his hump was huge, and the press side was also very deep. The difference between the left and right side is more mild. Hump is smaller, and what was our very big focus, the depressed side, is now more filled up. So this was 2 years before. They were coming to the BDA course regularly, and I will share you my experience from the assessment. I will now show you the results after 6 months. If you look at him here, you can see the curve there. So you can see like it was very deep. So you can see this big twist inside. It was going all the way in, and here was a big depression. By the way, this was already much better in respect to how it was before. So you can imagine how it was 2 years ago. So, but now we are observing that and comparing to how it is now. So what do we see? He's more shallow here. So he's not so deep inside. He's not sinking so much into this area. So one of the reasons why this happened is because the lower ribs there, the depressed side, is now more wider. So when the depressed side is more wider, then what happens is you don't see such a pronunciated hump. He's laying on the side and creating pressure on his hump there, creating pressure on his hump here as well. So by doing that, we can observe how his spine is looking like. And you can see there that actually it's now more straighter. So he is adapting to the floor in much better way. So there is a point of pressure. Here is a point of pressure. Previously, the spine was going into the big curve. Now the curve is more mild. And if you just look at his hump there, you can see that it was popping out much more in respect to how it is now. I'll talk about the flexibility. So previously I tried to make a curve in his back. So here I'm trying to lift him up there. And you can see, again, we see this hump here, which is like frozen. It's not moving. And we are looking at this place here, and that place is really, really stiff and not movable. And when we look at him now, we see the softer hump. We see more movable spine there. And he is making significantly, he's straightening the curve much more in respect to how it was. Here I'm raising him up. And in one moment, the weight of his body will kind of end up on his torso, spine, and we are looking how he's reacting. So the pressure is ending up there, and the pressure is so the lower ribs and the pelvis, they are colliding each other. So now the question is, how strong is this depression? How strong are these lower ribs? If they are very soft, then they will just buckle, they would collapse, and then he will make a very big curve with his spine, which in this case become a passenger. He's not really holding anything. What he's holding is actually this area here. So now you look at him here, and look, there he goes, and what do we see? We see now more space here. We are starting to see that these lower ribs are also holding him, and thanks to that, we can actually see a completely different curve in his spine. So under his own body weight, this area here is starting to give more support, is not collapsing as much as that was the case there. So you see, I'm not really holding him because I deliberately was moving arms down and up to show that the weight is on the torso in the same way as I did it before. And we can see quite big difference. Just looking at his back, we can clearly see less curvature. So if he went now to do some kind of X-ray, he would have less uh, uh, the angle of the scoliosis would be smaller. So for sure, like if he was here something like probably 55 degrees or 60, he would probably be 45, 48 or something like that. And this is a rough estimation, but clearly we can see the big difference in his in the position of his spine. So instead of situation getting worse and worse and worse, we are looking every time he is getting better and better and better. And if we compare, for example, and I will try to make a video of that as well for you. This was when he was a bit stiff. I did a lot of things with him, putting him in different positions. He was a bit tense. So, and even then, we can see a big difference in the curve. So previously, you can see the hump was protruding really a lot. There was a big rotation and a big depression here. Now, when we look at him, the hump is smaller and he have more volume in the area where he was more depressed. It's very obvious. Just look at the hump there and look at the hump there. It's a very big difference. And then you show me how he is when he is relaxed. That's what we see. That versus this. Absolutely amazing difference. So he's doing really, really good. The next phase of exercise is going to be you will start using our new tools for exercises, which we were developing for the last 6 months. Actually, Vladimir, the colleague which is working in Russia, really worked on that a lot. And we started working with our patient, and it made a really, really amazing results. So you are going to follow his ribs with a ball which is vibrating, and with that vibration, you will kind of increase the dipsotrophy effect of the connective tissue. He will start to become. You will unpeel all the tightness in his body, and he will just start to breathe deeper. Then you start to get volume. You start to get even more relaxation of his spine, because the more the rib cage becomes softer, the more his spine is movable. And then the next phase is actually that you start to increase the strength, which is more connected with control. But for that, it's still not time. Because if we start doing this now, putting him in some positions when he's supposed to straighten his body and do some stuff, it will be too hard for you and we will be very inefficient. Everything is going at this particular moment in the correct way. He is going like good, better, better, better. In one moment, he will start to have more active exercises, and for that, it will be a little bit harder for you, but we don't want that to be too hard for you. So that's why it's still no time for that. There is still so much space for the improvements in what you are doing now that we want to keep on going in that direction.